Good morning. My name is Heather Cox, and today I'm going to talk to you about how to give IV push medications. The first thing I'm going to show you is some of the equipment and some things you need to do in order to prepare to give the IV push medications. And while we're filming this video, we're going to show you two different ways to do IV push medicines. One when you have a saline lock, and the other when you actively have fluids infusing. So if you look at the table with me, I'll show you some of the equipment. Off to this side, you'll see that I have my drug references. And I've talked to you before about drug references whenever we did the IV piggyback medications, but there are a variety of different drug resources that you can use. You do have your Davis's Drug Guide, and I think you guys are up to 16th edition by now. Sometimes you have intravenous medication texts, and of course you'd want the most recent up-to-date editions whenever you guys are looking up medications. You can also look up through LexiComp or through Lippincott Advisor, whatever your resources are. Just make sure you have one to look it up because there's certain things you need to pay attention to. What I'm going to go ahead and do now is show you the rest of the equipment here on the table, and we'll come back to the drug resources. So certainly, whenever you're coming in to do your IV push medications, you're going to need some equipment to draw up the medicines. And if you look down here, I've got several different syringes. This one here is a 22 gauge, 1.5-inch needle, and it's a 3 milliliter syringe. I've got some other 3 milliliter syringes here without needles on it. I've got a 5 milliliter syringe, and then I've got some actual needles for drawing up the medication. Now remember, whenever you're going in to give IV push medications, most of your systems are needleless at this point, but you'll actually need the needle to draw up the medication from the vial or whatever the medication is stored in. Sometimes your medications actually come in a pre-filled carpet, and you may have some equipment that you would use to administer the medicines in that manner. But I'll show you how to go through and use the syringes and things in a minute. What's important is that you know what size syringe to use based on the amount of liquid that you're giving. Because certainly if I need to give 4 milliliters, I need a larger syringe than a 3 milliliter. The other thing you have to consider is if your medication has to be further diluted whenever you're drawing it up, because if I'm drawing up 3 milliliters and it's supposed to be further diluted with, 2 to 3 milliliters, then I'm going to need probably a 10 milliliter syringe instead. So always make sure you consider, am I just giving the undiluted medication from the vial, or am I going to have to further dilute it? What do I have to do? If you also look over here, you'll see that I've got some pre-filled saline syringes, because whenever you give your IV push medications, you're the one actually controlling the flow of the medication. You need to flush the IV before to make sure that it's patent. You need to give the medication, and then you need to flush after to make sure that all the medication is administered to the patient. You'll also see that I have some labels here, because anytime you draw up a medication from a container that it was originally in, you must label the syringe immediately with the medication, the dose, date, time, initials, because you've taken it out of its original packaging. You'll see that I have some alcohol wipes over here because I need to be able to swab my ports and things. And then further, you'll see here that I have some red caps because, as I said, normally you're going to be administering through a needleless system. So once I draw up the medicine, I'm going to want to get rid of the needle and put a red cap on the end of it so that I keep the end sterile and so that I don't have any issues with that. Currently, I'm going to come over here, and anytime that you're given medications, you have to always do your 3 checks and your rights of medication administration. Make sure what you're given, verify your order, clarify any inconsistencies, make sure your patient doesn't have any allergies. So what I'm going to do is we're going to look at this medication, and you'll see here that what I have is furosemide or Lasix, and you'll see that the dosage strength is 40 milligrams per milliliter. And you have to know what you have so that you can go ahead and do your calculations and things as you're working through. So when I'm looking at this, furosemide, 40 milligrams per 4 milliliter, and I would want to look at my order and see how much of the dose is ordered so that I know how much of this to draw up, and then I can actually do my math. Now what I'm going to do is take you over here to the drug reference and show you a few things that I need to look up, since I know that the furosemide is the medication that I'm going to be giving. As I had showed you before, you can either go to the index in the back and look up furosemide or Lasix alphabetically. When you look at this, there are certain things you need to look at. As always, you've got the generic name and the trade name. You'll see the indications, what the classifications of the medicine is. So this is a loop diuretic. And then when you come on down, it'll give you your usual dosages, so you can confirm if this is a safe dose, and it will give you reasons for what the medication may be given for. And it may give you some reasons why this dose may need to be modified. If you move over to this side, it speaks to you about dose adjustments, and it also speaks to you about dilution. And this is always very important with your push medications because you need to know if this medicine needs to be further diluted. And as I'm reading here on the Lasix, it says may be given undiluted. There are some medications that need to be further diluted after you draw them up, so make sure you look at your drug reference and be sure. You'd also want to look at compatibilities because I would need to know that if this medication is going to be given through an IV that's already infused and that has medications infusing with it, if it's compatible and if I can give that with that medication. When I look at the dilution, you see that I can add it to normal saline, which is what I'm going to be flushing it with, and this is what my patient, I've verified his fluids, that's what he's got infusing. So I know it's compatible with normal saline. He doesn't have any other additives infusing, so I don't have to worry about any further compatibilities at this point. Then I'm going to flip over to the next page, and another area that's important is the rate of administration. So if you look here for furosemide or Lasix, it says each 40 milligrams or fraction thereof, which means 40 milligrams or less, should be given over 1 to 2 minutes. So this allows you to make the choice of how much time you're going to administer this over. And you need to know these things because whenever you do your calculations, it's imperative for you to do the calculations so that you figure out what you're going to be doing. Certainly you'd want to look through and you could see your actions, indications, if they're contraindications for the medications and any precautions and things like that. You would need to do any pre-assessments before you give your medications and things, and especially for Lasix. Lasix is a loop diuretic, so you'd be worried about your potassium levels. You'd certainly want to assess those before you give the medicine. Since it is a diuretic, you want to be keeping up with your intake and output. And just remember to correlate all these things since these actually go along with medication administration. So now what I'm going to do is I'm going to move over to the board and we're going to do the calculations at this point so that we can work up from the dose that's ordered, from the order that I actually compare, so that I know how much I need to draw up and then what time frame I need to give it over, and then we can go from there with the math, and then we'll actually get to the actual administration part. Now we're going to move over and do the math. Alright, so now we're going to move over and we're going to start doing the math. And whenever you start doing the math for IV push medications, the first thing you need to know is what is the actual order. So you're going to verify your actual order, and let's say the doctor ended up ordering Lasix 20 milligrams IV push, and we'll say stat. Then I need to know what I have available or on hand. And I'd have to actually look at my vial or whatever it is I'm drawing up the medicine from. And when we looked at the vial a while ago, we had Lasix 40 milligrams per 4 milliliters. And so I want 20 milligrams, and I've got 40 milligrams and 4 milliliters. So the first part of the math is where you have to go through and find how much volume I'm actually going to give. So I know that I've got 40 milligrams in 4 milliliters, and I know that I want 20 milligrams based off of the doctor's order, so I'm going to be solving for the milliliters. When I go through and do my cross multiplication, then we would end up with 40 milligrams per X milliliters and 80 milligrams per milliliter. I now need to come through and divide by the 40 milligrams, and that should then give me a 2 milliliter volume that I'm going to give. And always go back through and see if this makes sense. If 40 milligrams is 4 milliliters, then it makes sense that 20 milligrams would be 2 milliliters. So this is the total volume that I'm going to be actually administering to the patient, because when I looked up Lasix, I don't have to further dilute the medication. The second step whenever you're doing push medications is you have to determine the time frame. And my drug resource, whenever I looked it up, said that every 40 milligrams or fraction thereof can be given over 1 to 2 minutes. So you therein have the choice of going over 1 to 2 minutes. And I'm going to choose the longer time frame because longer is always safer. And potentially with Lasix, whenever you look up this medication, some of the precautions are that if you give it too quickly, it can actually cause ototoxicity. So what I'm going to choose is the 2 minutes to give this medication. So basically what they're telling you here is that I need to determine what the time frame was that I was going to give it over. And what I did is I actually picked it, and it says not to exceed 40 milligrams in 1 to 2 minutes. So if I come in here and I say that I'm going to give 40 milligrams in 2 minutes, then I would need to give the 20 milligrams in however many other minutes. And let's work that out just so you can see how to go through and do the math. I need to convert the minutes to seconds, so 2 minutes would then be 120 seconds. And then 20 milligrams would be X seconds. And I go through and I do my cross multiplication. And I'm going to say 120 seconds times the 20 milligrams, and it's going to give me the 2,400 milligrams per second. And then on this side, it would be the 40 milligrams per X seconds. So what I now need to do is come and divide by the 40 milligrams. And whenever I solve for this, 2,400 divided by 40 should give me 60 seconds. Now basically what this is showing you is how we do the math whenever you've been given math problems, for instance, in class. Whenever I go through, if it tells me every 40 milligrams given over 2 minutes, then if I solve for 20 milligrams, it gives me 60 seconds. So this actually is consistent with what the minimum time frame is. Now if I wanted to, I could choose to come in and give it over 2 minutes instead. I'm going to stick with the math, and let's go ahead and say that we're going to give the 2 milliliters over the 60 seconds. And so I'm now going to do the third part of the math. And in order to do the third part, you always take the volume and the time, which is what you solved in the first 2 steps. So I'm going to say 2 milliliters over 60 seconds. And typically on your math test, we're going to give you a time frame and ask you to solve for how much are you going to give her, 30 seconds or 15 seconds or, whatever it is that the math problem asks for. In the real world, you're going to have to come up with how much that you want to solve for. I typically always solve for 15 seconds because that's small increments that I can keep up with. So we're going to say the full volume I'm giving is 2 milliliters. We're going to give it over 60 seconds. And I want to know how many milliliters I'm going to give over 15 seconds. So when you come through and you do your math, you're going to do your cross multiplication. So I would have 60 seconds is to X milliliters. And then 2 times 15 is going to equal 30 milliliters per second. I need to divide by the 60 seconds. And basically when you get finished, when I divide 30 by 60, I should get 0.5 milliliters. And what you need to do is go back and make sure if this makes sense. And if I'm going to give a full 2 milliliters in 60 seconds, then I would give 1 over 30, and then I would give a half a milliliter over 15. So now I've gone through and I've confirmed the doctor's order, and I know what I'm supposed to be administering, which is a full 20 milligrams. In the first part of the step, I then looked at what I had available and I solved for the total volume that I'm going to need to give to administer that milligram dosage, which is 2 milliliters. In the second step, I went through and based on my drug guide reference, I determined what my total amount of time is that I'm going to give this 2 milliliters, and I determined that it was over 60 seconds. And in the last step, I determined how much volume I was going to give in a 15-second increment, because whenever you give push medications, you give them slow and steadily over increments. So basically, when I went through and did the math, I'm going to take my vial and draw up a full 2 milliliters, and as I'm administering, I'm going to give 0.5 milliliters over 15 seconds. Now we're actually going to move to the bedside, and we're going to actually go and administer the medication. I'm going to show you 2 different ways to give it. Both are IV push methods, but one is through a saline lock with no fluids infusing, and the other is given through the actual tubing with primary fluids infusing. Now we've gone through and we've looked at what the doctor's order was and confirmed how much of the Lasix we're supposed to be giving, which was a total of 20 milligrams. And whenever we did the math based on the amount of medication we have on hand, it was going to be 2 milliliters. So I went ahead and did the rest of the math and determined that I'm going to give the full 2 milliliters over 60 seconds, and when I divided it into increments, I'm going to give 0.5 milliliters over 15 seconds. I've gone ahead and I've drawn up my medication, and you guys have drawn up from vials before, so I'm not going to go back through that at this point. But when I drew it up, I've got the full 2 milliliters of the Lasix here, and I've also got it labeled with the medicine and the dosage, the date, the time, my initials, and then with Mr. Shapiro's information. I've got this in my hand. I never let it out of my sight. I'm ready to now enter Mr. Shapiro's room. I've got my other equipment in my pocket, which I'll lay out for you and show you in a minute. So as I enter, I'm going to go ahead and I'm going to phone, knock on the door. Hello. I'm going to pull the curtain as I come into the room. Mr. Shapiro, my name is Heather, and I'm going to be your nurse today. And I'm coming in to give you some medication here that the doctor has ordered for you. I'm going to go ahead and perform aided at this point. Mr. Shapiro, would you please tell me your name and date of birth? And I'm going to confirm that it matches his armband. And Mr. Shapiro, do you have any allergies? And he denies any allergies, and I'm going to compare it with his armband. And I've already compared this with a chart outside of the room as well. Again, I've already confirmed the order for the medication. I would have confirmed any assessments that needed to be done since this is Lasix. I would have looked at his potassium level at this point to make sure it's within the normal range. I would have compared his intake and output. You know, I might ask him how he's been doing, and I would note any swelling, since most of the time this is given for edema. There can be other uses. I would explain to him that I'm going to be in here in the room probably for about a total of 5 to 10 minutes given the medication. Ask him if he has any questions. He says he's had this medicine before and that he doesn't have any questions or issues at this point. Now, since we're given a medication, you need to make sure you go through and you do your 3 checks and that you do your rights of medication administration. You ask your patient about any allergies and do any assessments that are required. So at this point, I would make sure that I've got the right medication, I've got the right dose, I'm giving it through the right route at the right time. I've got the right amount of medication, and I've verified the patient. I would need to scan the vial, and I would need to make sure and scan the patient and do whatever you normally would do for your assessments. At this point, I need to go ahead and assess his IV, and I could have done this whenever I was in the room with him before to make sure before I drew up the medication that the IV site was, in fact, dry, intact, patent. So when I look at his IV site, I need to make sure that there's no swelling, and it's not cool to the touch, and he's not having any pain to the touch, signs and symptoms of potential infiltration. I need to make sure that there's no redness or streaking, no swelling, no pain at the site, which could be signs of inflammation, phlebitis. And he says he's not having any pain at the site, and it looks clean, dry, and intact. There would be a date, time, initial, and a gauge here so that I know that the IV site is within the time frame for the policy of the hospital. Now, I also need to assess if this IV is patent. At this point, in order to do that, I need to put on my gloves because he currently has a saline lock here. So I'm going to go ahead and put on my gloves, and let's get out my other equipment. The other equipment that I have here with me are some alcohol wipes and some saline flushes. So now that I've got my gloves on here, I would now go through and I would open up my saline flush. And it needs to be a new saline flush. Remember, you either push up or pull back on the bottom to break the air seal. And then you need to go through and get the air out of the flush to make sure you don't inject any air into Mr. Shapiro. I'm going to go ahead and grab an alcohol wipe. He may well have had an orange swab cap over here, which is impregnated with alcohol. If he did, it's not required once you take it off to re-swipe it again unless you're afraid you contaminated it. He doesn't have the swab cap, so I need to go and swab this for 30 seconds. We'll say it's been 30 seconds. Then I need to go and I need to push in and twist to the right. And I need to go ahead and unclamp the saline lock. Now at this point, they like for you to pull back and aspirate and look for blood in the line. You may or may not get blood. You would prefer that you do, but if you don't, go ahead and flush and make sure that you're not seeing any swelling or any issues. The patient isn't complaining of any pain. And you can go ahead and flush with up to a full 5 milliliters of the normal saline here to ensure that your IV is patent at this point. I've now determined the IV is patent. There's no issues with it. So what I'm going to do while I'm flushing, I'm going to go ahead and reclamp this line. I would now take this flush off, and it would need to be discarded when I'm done because you only use a flush one time. I'm now going to come and I'm going to take an alcohol wipe, and I would need to re-swab the port. You'll notice when I brought my medication in the room that I had actually took the needle off after I drew it up, and I put a red cap on to keep the tip sterile, and so that I'm also not transporting needles around, because we like to keep it a needleless system. So when I take the red cap off, I could put it over here to be disposed of. I need to keep the tip of the medication sterile. Swab this for 30 seconds. Once it's been 30 seconds, I need to let it air dry. Once it's air dried, I can now come and I can attach my medication. And then I can unclamp my saline lock. Now, I need to make sure that I've got a watch with a second hand, because I need to observe this. As I'm giving the medication, I need to give the increments that I have already determined with my previous calculations. So at this point, I know that I'm giving a full 2 milliliters of medication for the dose of 20 milligrams of Lasix, and I determined that I need to give 0.5 milliliters every 15 seconds. So I'm going to wait till I get to a mark, and I'm going to go ahead and slow and steadily give 0.5 milliliters over a 15-second increment. And once I'm done with that, then I come back in, and now I'm going to give another 0.5 milliliters slow and steadily over a 15-second increment. And now I'm to my next 15-second increment. I'm going to give another 0.5 milliliters slow and steadily over a 15-second increment. And as you watch, you can actually see this medication, because we colored it for you. You can see it actually going through the tubing here. I've now met my next increment, so I'm now going to give my next 0.5 milliliters slow and steadily over another 15-second increment. I'm going slow and steadily, making sure that I'm not injecting more than 0.5 milliliters every 15 seconds. My medication has now come out of the syringe, and part of it is left in the saline lock here. So now I need to come and I need to clamp this off, and I would unhook this, and this needs to be disposed of, and we'll dispose of it here at the end. I'm going to come and get me another flush. Make sure that I push up on it or pull back and get the air out of it again. Again, it's a new flush every time you do this. I need to come back and I need to swab this for 30 seconds. Let it air dry. Reattach my saline flush. Go ahead and unclamp. Now at this point, if you'll remember, there is medication left in here in the line. So when I come and do the next flush, I need to do it slow and steadily over the increments that I've already calculated. So again, I'm going to give 0.5 milliliters over a 15-second increment. And then I would continue with another 0.5 milliliters over a 15-second increment. And again, continue with another 0.5 milliliters over a 15-second increment. And I would continue on in this manner until I flush with the full 5 milliliters, or depending on what your facility policy says that you must flush with once you're finished. Once I'm done with the complete flush, then I'm going to come, and as I'm flushing, I'm going to clamp the clamp off. And at this point, I could put an orange cap, a swab cap back on this, so that it stays impregnated depending on your facility policy. At this point, you'll notice that I have several things here that I would need to dispose of. Certainly the alcohol wipes would need to go into the trash, any of the packaging or any of that stuff. Your syringes would need to go into the sharps box and be gotten rid of over here. I need to make sure that I've come back over here, and that while I'm giving the medications, I would need to speak to Mr. Shapiro, make sure he's not having any burning at the site, there's no issues with the IV, make sure that I'm not meeting any resistance while I'm flushing or giving the medicine or any of these kind of things. While I was giving the medicine, you saw that the first flush that I gave was just simply to flush the actual saline lock. Then when I gave the medicine, I gave it slow and steadily over the increments that I had calculated with the math. So it was 0.5 milliliters over 15 seconds. And then the very last flush, you have to remember that I have medication in the line, so I must give the last flush over the increments that I've already calculated as well. Otherwise, what it would do is push the medication in very quickly, and you've negated the purpose of the increments that you were doing in the first place. So once I'm done giving him the medication, then I would certainly document, and I would need to check back on him and make sure, do any further assessments that would be needed for this medication at this point. Now that I'm done with the medications and I've gotten rid of everything, I could go ahead and I could take off my gloves and I could foam. And again, confirm with him, you know, what kind of directions and things that I would need to do in regards to this medication. Make sure that his bed is low and locked. Thank him for allowing me to come in with him today. Again, come back and reassess the IV periodically depending on your policy for your facility, and keep up with him in regards to the medication. This completes the portion of giving the IV push medicine through the saline lock. The next portion of the video I'm going to move to is actually giving an IV push medication whenever you have primary fluids infusing, so that you can see the difference. So this portion of the video, I'm actually going to come in and we're going to administer the IV push medication whenever there are primary fluids actually attached and already infusing. So I'm outside of the patient's room, and I've already gone through and I've confirmed the order, clarified any inconsistencies. I've made sure what the dose is I'm supposed to give. If the patient has any allergies, I had confirmed that it was Lasix 20 milligrams that I needed to administer. When I looked at the vial that I had on hand, it ended up being a 2 milliliter dose, and I would have gone ahead and drawn that up. You've already drawn from vials before, so I didn't show you how to go back through that. But what I did is I drew up the full 2 milliliters, and I took off the syringe and I put a needleless cap on so that the end stays sterile and I don't have any needles whenever I go in, because I'm using a needleless system. This has been labeled with the medication and the dose and the date, time, initials, the patient's information, because I've taken it out of the original container. While I'm outside of the room, I'm now going to knock, and I'm going to provide for privacy, and I'm going to foam as I come in. Hello, Mr. Shapiro. My name is Heather. I'm going to be your nurse today. I can put my medication here in my line of sight because it's labeled. Mr. Shapiro, can you please tell me your name and date of birth, sir? I'm going to compare that it matches his ID band here, and I'm going to ask him if he has any allergies, and he says no. Again, I've confirmed his name and date of birth, and I've identified my patient, and the report of no allergies is consistent with what I found in the chart. I'm going to let him know I'm going to be in here probably about 10 to 15 minutes giving you some medication the doctor's ordered for you. He said that he's had Lasix before. I asked him if he has any questions or concerns. I would have certainly gone ahead and done any assessments that I needed to do in relation to the medication before I got in here. Now, I probably would have already assessed the IV site earlier whenever I was interacting with Mr. Shapiro, but I'm certainly going to do that at this point now too. Other assessments with the medication, again, confirming the potassium order since it's a loop diuretic, what his potassium level is, confirming what his intake and output is, and keeping up with that throughout the administration. I would have gone ahead, since this is a medication, and I would have done my 3 checks, and I would have done my rights administration. I'm verifying I've got the right medication, the right dose, the right route, the right time, the right patient, of course the documentation at the end. I've done my assessments and confirmed no allergies. So now I'm at the point where I would have scanned the medication and scanned the patient, and I need to assess his IV site. So if you look at this, he actually has primary fluid infusing. So I need to go ahead and confirm that this is normal saline and it's 0.9% sodium chloride. I need to confirm that the bag has been labeled date, time, and initials, that it's actively infusing. I need to note that the tubing is labeled with date, time, and initials, and that this is infusing at 100 milliliters an hour. Follow the tubing back to the patient. Nothing is clamped. And his IV site looks intact, and I could say that it's patent because it's infusing, and there's no signs of infiltration or phlebitis, no issues here with the actual IV site. So since I've assessed the IV site and he actually has fluids infusing, I could say dry, intact, and patent. I'm now to the point where I'm ready to go ahead and give the medication. So since he has fluid infusing, I now need to come over here and put hold and pause the pump. Now, this is one of the older pumps. They do have newer pumps, and you can actually put the pump on standby if you need to for the newer pumps. But at this point, I'm just going to put hold. Then I'm going to come over here, and I'm going to get my gloves and get my equipment out, because I should have brought some other things in with me besides just the actual medication. I need to have at least 2 syringes of normal saline and some actual alcohol wipes here. Once I put my gloves on, I'm now going to come and get an alcohol wipe. And I need to be prepared to come to the port closest to the patient. So if you look, he's actually got his saline lock here. This would be the port that's actually closest to the patient. When I'm ready to use this port, I'm actually going to swab it, but I need to get my saline prepared. Again, you need to push up or pull back on it to make sure you break the seal. And I need to get out any air before I start. I would now come and swab the port closest to the patient for 30 seconds. Once the 30 seconds is up, I need to now let it air dry. Without touching it, I need to push in and twist to the right. And now, once I'm to this point and the saline is now attached, I need to crimp the tubing immediately over the port closest to the patient. I now need to pull back on the syringe and aspirate and look for blood return here in the IV. You may or may not get blood return. Blood return would be good, but if you don't get it, whenever you go through and you flush slow and steadily to make sure that your IV is in fact patent. And you'll notice that I'm keeping this line crimped the whole time. And I need to flush with the full 5 milliliters of normal saline, whatever your policy says. As I'm doing this, I'm watching my site to make sure there's no signs of infiltration, the patient's not having any pain, it's infusing without difficulty, and I'm not having any issues here. Once I'm done with the normal saline, I'm keeping this crimped above the site. I go ahead and take off the saline flush, and I'm now ready to give my medication. At this point, I need to come back. I'm keeping the tubing crimped again. I need to come and I need to re-swab with an alcohol swab for 30 seconds. Once the 30 seconds is done, I need to let it air dry. I can now take off the red cap from my medication without contaminating the end of my syringe. I can push in and twist to the right, and you will see that I'm continuing to keep the tubing crimped here right above the port closest to the patient. Now I'm ready to give the medication over the increments that I've already calculated. So I need to make sure that my second hand is here, and I had already calculated that I'm going to give 0.5 milliliters every 15 seconds, so I need to wait until I get to a mark where I can do that accurately. I'm now going to give 0.5 milliliters over my 15-second increment. The pump may start ringing on you. If it does, it's okay. Just continue with what you're doing. I'm now to my next increment, and I'm going to give 0.5 milliliters over 15 seconds. I could actually stop here and keep this crimped and just put the pump back on hold again if it's making noise. Keep this crimped. You'll notice that we've got this colored so you can see the medication is actually infusing through this portion of the tubing, and it's not backing up down this portion of the tubing because I'm keeping it crimped. It's actually going towards the patient. Again, I need to go ahead and give a 0.5 milliliter increment over 15 seconds. And I'm now ready to give another 0.5 milliliters over 15 seconds. I'm now done with my medication. I need to keep this line crimped, and I can take this and put it to the side until I'm ready to dispose of it properly. I can pull out my next saline flush, and I need to pull back on it or push up before I take the cap off. Make sure that I get any air out of it before I start. I need to now get a new alcohol wipe. I need to come and I need to swab the port closest to the patient for 30 seconds. I would now need to let it air dry. You'll note that I continue to keep the tubing crimped above the port closest to the patient. And I'm now going to come and flush with the normal saline at the same rate that I was giving the medication. So since I had already determined that I'm giving 0.5 milliliters every 15 seconds, I'm going to continue with that to make sure I can see with my watch. And as I'm flushing, you'll notice that the colored medication continues to infuse into the patient. I'm keeping the line crimped so that it doesn't back up down the line, but that it truly goes to the patient. Again, 0.5 over 15 seconds. And again, 0.5 over 15 seconds. I would do this with the full 5 milliliters of normal saline or whatever your policy says. Once I'm done with this flush, I can now come and take off the saline flush, and I can now uncrimp my line. I have now I flushed before to start with to make sure that the line was patent. I crimped and I crimped before I did that, and I made sure that I gave the medication slow and steadily over the increments. I made sure that I came with a flush behind the medication slow and steadily over the increments. Now that I'm done doing the pre-flush, the medicine, and the post-flush, I can now uncrimp the line, and I need to come back and check the fluid rate to make sure that it's consistent with what the doctor has ordered. So what I'm going to do now that I'm done with the actual medication administration, the IV line is fine, I'm going to take off my gloves here, and I'm going to foam. And again, come back and check the pump, and I need to confirm that it is consistent with what was ordered for the primary fluid rate, and it's 100 milliliters per hour. So what I'm going to do is I'm going to come back up here, and I'm going to actually hit primary run, and I need to make sure before I leave the room that the fluid is actively infusing, that there are no lines that are clamped or crimped anywhere along the line. Make sure the IV pump is actually restarted and it's infusing. Continue to assess Mr. Shapiro to make sure he doesn't have any problems with the medication, any assessments that are pertinent to the medicine. Make sure he has his call bell, the bed is low and locked. Thank him for letting me come in and care for him today. And continue to monitor him in relation to the medication. We've now gone through the video and we've talked about how to do the math and how to do your increments. We've gone through and we've confirmed how to give an IV push through a saline lock with nothing infusing, and we've actually given an IV push with primary fluids infusing where we pause the pump and crimp the line and flush and give the medicine and then flush again, all with the line crimped, and then restarting the pump. We're going to now tell Mr. Shapiro we'll be back in to assess him probably in about 10 to 15 minutes, and have a good day.